Join me as we talk about whether or not you should disclose your autism to your doctors or not. Why am I recording this when I am sick? Because you need this information. I felt it's important enough to share this information for you about should you disclose to doctors whether or not you have autism. Usually I have a pretty good immune system, but not this year. The whole purpose for this video is basically I was sitting in the doctor's office at the urgent care waiting to be seen. Should I or should I not tell them? And then I just came to the conclusion that there just really wasn't any need for me to tell them at the urgent care. Other than me sitting there stimming while I was waiting on them to come in, there was really just no reason I felt like to share that information with them. I didn't think it would impact my diagnosis in any way. But there are definitely times when you need to let your doctor know that you have a autism diagnosis. Case in point for me, I did tell one doctor, I'm seeing a urogynecologist, she was going to do a surgical procedure on me, and so I had surgery procedures before when I didn't have a diagnosis, and pain seems to affect me more than other people. What I mean is, I had a back procedure several years ago, and they told me that most of the time it really doesn't hurt. It's not painful. Well, I was about screaming and crying during this procedure I was awake for, and they didn't understand why. And of course, why did most people? It wasn't painful, but it was more painful for me because I have a hypersensitivity to pain. It might be a reason you might need to tell a doctor. The reason I felt like I needed to tell the urogynecologist was because of the hypersensitivity I have to pain, and I was afraid the surgery might be painful for me because she told me that most people say the surgery is not that painful. So I just wanted her to know for me it might be more painful. So at that point I told her that I had autism. She had a little bit of a confused look on her face. I'm sure she probably didn't understand what it was. Probably didn't even go and research it after we talked about it. But anyway, I did tell her. Now, the surgery afterwards, when I was in the recovery room, I was having some problems. I was screaming out, and because they had put a catheter in because the surgery had not gone well, and they had put a catheter in, and so I was screaming and yelling out, and this was going on for a long time, and they felt really sorry for me. So at that point I was glad I told them about the autism diagnosis, because maybe because of that, they did something to help me. They seemed more kind about it, more sensitive to my needs. I found a really good article online about should you disclose to the doctor that you have autism, and I'll share it with you right here. Okay, so you can read along with me. I'll have it right here for you. Should I disclose my ASD diagnosis? It's your choice, is what it says. In most cases, the benefits of disclosing a diagnosis far outweigh the risks, but you need to weigh the risks and benefits. So what are some possible benefits for telling your doctor? Understanding. Knowing your diagnosis may help the healthcare provider to understand you better and provide better health care. Well, if you're a woman on the spectrum, I kind of doubt it unless they have personal experience with someone in their family. I don't think it's very likely, but hopefully they would want to learn about it. Communication is another possible benefit. Knowing your diagnosis may help the healthcare provider not to misinterpret the things you say and do. Well, that can come in helpful if you are not good with gestures and things, eye contact. When you're talking to your doctor, they may think there's something different about this person. So if you were to tell them, then that might clear a few things up and take some pressure off. Avoiding misdiagnosis. It says knowing your real diagnosis may help the healthcare provider not to misdiagnose you with something you don't have. If you're going to a mental health professional, you need to tell them your diagnosis. I see a wonderful counselor who understands autism in women, and seeing her just makes all the difference. So try to find someone that you can talk to, somebody that you can possibly unmask for, so they can see the real you and help you get through what you're going through. Another possible benefit is accommodations. If you disclose, you can ask for specific accommodations or strategies to help you to better access to a quality health care. So something I can think of that might apply to this is that doctor that I told that I had autism to, I asked her if I could videotape her summary of how my surgery went. Because I have a hard time processing information in the moment sometimes, especially in a doctor's office where I'm already fearful of being there. And so a lot of times I forget half the stuff they say. So I just had this great idea of asking her if I could just videotape what she was going to say. She shut me down. She said no. Luckily my mom was there, so it had a second pair of ears to hear what was going on as far as what she was saying about the surgery. So doctors out there who are nice enough to let you to videotape, if you don't understand what the doctor says very well in the moment, you got to process it. I think this doctor was afraid that maybe I was going to use a video for some other reasons. Maybe I just needed to communicate better what the purpose of the video was for. And then another possible benefit is referral for formal ASD diagnosis. If you don't already have a diagnosis, your healthcare provider can help you get one. Okay, what are some possible risks of diagnosing your ASD? Misunderstanding. The healthcare provider may not know very much about autism and may misunderstand what it is, but you can educate them. I just don't like that part because I don't feel like it's my job to educate people. I'm still learning a lot about it myself, and just trying to deal with it on a day-to-day basis. I feel like I can tell them my diagnosis, and then they can go and look it up for themselves or ask me questions. Number 2, a possible risk is misjudging abilities. The healthcare provider may underestimate your abilities. For example, they think you don't understand things that you do, or they overestimate your abilities. So, they might think that, you can't understand them when they're speaking or something, which is not true. Just your processing speeds might be different, or, understanding capabilities, but they just don't understand. So sorry. Okay, another possible risk of disclosing your diagnosis is disbelief. Some providers may not believe your diagnosis if you do not fit the limited understanding of what people on the spectrum are like. I think this is going to be definitely more a possibility if you are a woman on the spectrum. Confidentiality. While healthcare providers are not allowed to tell other people about your diagnosis in most circumstances, there's a small chance that they could. So you have to weigh the benefits, of disclosing your diagnosis to healthcare providers for yourself. So I want to thank you for watching this video today. I am recording this video because, I'm just obsessed about my hobbies like that. I just constantly need to be doing something, even when I'm sick. I cannot rest. I'm not one to go lay in the bed. I just can't. Cannot do it. Just can't. Can you relate? So, that's the video. But thank you for watching, and I hope you will subscribe to this channel. And we'll see you in the next video. Bye. Where I'm sure I'll feel better by then. Let's hope so. I don't need another sickness around Christmas.